succession to the videos what I have been taking up in gynecology and pregnancy related topics. So today's video, I'll be mainly focusing upon the twin pregnancy, and this topic I have taken because there were so many comments and there is so much of queries coming on this topic. So basically, twin pregnancies, in this video I'll be discussing about the various signs and symptoms which an expecting mother of twin pregnancy mostly faces. So it has been very commonly it has been a very there has been a great curiosity among the expecting mothers, or those mothers who are planning to get pregnancy, those who are planning for a pregnancy. That has been a very common query, and this inquisitiveness is there in the pregnant women, that whether they'll be expecting a twin pregnancy or a singleton pregnancy. So there has been very many factors related to it, and in this video we'll slowly and gradually try to understand that what are the symptoms and what is the chances of having a twin pregnancy, in what all situations one can have a twin pregnancy. So basically, twin pregnancy, as you all very well might be, you are very well aware, the name itself is suggesting that there are two fetuses. Now, this is actually a twin pregnancy condition. It is a very rare occurrence, and there has been implication. This has been very closely implicated and intricately related to the family history, because in the pedigree of the family, if there has been in previous generations, there has been chances of twin pregnancies, twins were born, so there is a likelihood that in the upcoming generations also twin pregnancies might happen. Other causes may be related to if the women is undergoing any kind of a fertility treatments are there. So any kind of fertility treatments, if the expecting mother or the woman who is trying to conceive, if she is undergoing any kind of fertility treatments, in such cases also there is a chance of having a twin pregnancy. Apart from this, this is a very common query, and this is a very great curiosity. There is a very great curiosity among the women who are planning for pregnancy, that whether she has a chance of getting a twin or not. So basically, when we look at this as compared to the age criteria, so this has been found that more elderly the age is of an expecting mother, the greater is the chance of having a twin. Because actually it is during the if a girl is in the gestational is in the age group lying between 20 to 30 years, so there is a less likelihood of getting a twin pregnancy as compared to an elderly age group women who are getting pregnant in the age of 30 to 35 or elderly age. So there is a more predilection for twin pregnancy in the elderly age group women, particularly above the age of 30 years. So now this actually pregnancy, it is a very exciting and a very emotional phase of the life, and it has been mostly seen that once a woman finds that she is pregnant, there is utter happiness and sheer happiness spreads in the family. But this sheer happiness, it also goes down with so much of worries and so much of concerns increase if a lady is expecting a twin. So the complications increase manifold, and the number of visits to the gynecologist, that is the prenatal care in case of twin pregnancy, is increased manifold. So prenatal care, the patient has to be very much conscious, and the number of visits to the gynecologist, the chances, the extra care is very mandatory if it is a twin pregnancy. So we'll be looking at the chances of twin pregnancy. So this is actually a very rare phenomena, and if 250 pregnancies are being there, out of which there is a chance in India that it might be one pregnancy will turn out to be a twin pregnancy one. So while looking at the signs of twin pregnancy, signs are those things what a doctor will find on evaluation for a twin pregnancy. So it has been pregnancy, it is seen that the expecting mother is to feel early fetal movements. So early fetal movements are there, and that too in the different parts of the abdomen. Although in a singleton pregnancy, the women experiences certain butterflies flying in the crawling in the stomach, there is fluttering of the butterflies within the belly. But in case of twin pregnancies, these butterflies will be felt in different segments of the abdomen. So actually, during a twin pregnancy, there is early fetal movement. Fetal movement is there in more than one area of the abdomen. Apart from this, when looking at the fundal height, so the fundus means the belly of the expecting mother, the fundal height is more in case of a twin pregnancy as compared to a singleton pregnancy. So actually, the expecting mother who is having a twin and is in the 32 to 34 weeks of gestation will give the appearance of a singleton pregnancy of a lady who is having 36 weeks of gestation. So actually, the bundle height is increased in case of twin pregnancy. And when we look at the baby bump, it is absolutely more, just because two fetuses are there, and the nutritional requirements and the demands have increased manifold. The amount of the amniotic fluid, these all factors are going to have an excessive increase in weight gain of the mother. So during a normal pregnancy, there has been found in a singleton pregnancy, the weight of the expecting mother increases from 10 to 15 kgs. But if it is twin pregnancy, the weight is abruptly going to increase more than this normal range. Apart from this, when we look for the most important indicator for a pregnancy test, it is the HCG hormone. So it is the HCG, that is the human chorionic gonadotropin hormone, which is responsible for, which is used for checking the pregnancy. So in cases of when we go for the estimation of these hormones, the HCG in case of twin pregnancy is elevated to a much greater extent. Apart from this, there is a protein which is being synthesized by the young fetus's liver, which is called as the alpha fetoprotein. And during the case of a twin pregnancy, the levels of alpha fetoprotein is more than the singleton pregnancy. So it is actually the HCG and the alpha fetoproteins, both the levels, both the markers of pregnancy, their value exceeds the normal range. Apart from this, during a fetal Doppler, if the ultrasonography is being conducted and the fetal Doppler ultrasonography is being conducted, there can be heard two fetal heart rates by as early as 9 weeks of gestation. So when the expecting mother at the gestational age of 9 weeks, if she is going for a fetal Doppler ultrasonography, so two distinct heart rates can be clearly discernible. Now, when looking at the symptoms, what the expecting mother herself feels during twin pregnancy, it has been found that it is more or less similar to the singleton pregnancy, but the intensity of such symptoms of pregnancy is more. The intensity will be more. For example, morning sickness is quite a common thing. The feeling of nausea, the feeling of vomiting during early morning. So this is a quite a common thing during normal pregnancies or a singleton pregnancy. But if it is a twin pregnancy, the intensity of the morning sickness, the nauseating feeling, the feeling of vomiting and dizziness, all such symptoms of morning sickness will be to a much greater intensity in case of a twin pregnancy. Apart from this, when it comes to the other symptoms, such as the expecting mothers, they are going to have breast tenderness. So that the amount of the breast tenderness will be more in case of a twin pregnancy. There will be unusual fatigue because there are two fetuses that were developing and they require more nutritional requirements and more energy is required. So there is an increased appetite. Apart from this, there is an increased fatigue of the expecting mothers. Apart from this, there is chances of frequent urination. It can be easily seen that frequent urination, the expecting mother more often runs to the loo. There is frequent urination, and it is an excessive weight gain is seen. There is increased hunger as well. Apart from this, the appetite of the mother also increases. And when we look at, there are nowadays during pregnancy, certain women, they are very much afraid of spotting or bleeding. So spotting or bleeding, it is quite a normal thing during pregnancy. During the course of the gestation, actually it has been found that at certain time of the entire 9 months of pregnancy, it can be seen that there is some kind of a spotting or bleeding in the undergarments, what the expecting mother can sometimes see, and she may actually worry about. So there is, if it is a slight bleeding or a slight spotting is there is nothing to worry about. The spotting can be either of a pink color or it can be a brownish discharge. So it is nothing to worry about. During a singleton pregnancy as well as in a twin pregnancy, the spotting and bleeding can occur at any time during the entire course, but there is nothing to worry about if the spotting, if it is a slight spotting or brownish discharge from the vagina. So actually during a twin pregnancy, the amount of the spotting or bleeding, it is more as compared to a singleton pregnancy. And so viewers and students, this was a very short video where I've tried my level best to simplify that what are the signs and symptoms. And I must recommend all the expecting mothers that you, if even if you want to get your whether you want to get it confirmed that your pregnancy is twin or singleton, you should immediately after the conceiving, you should, the best way to ascertain it is to go for an ultrasonography. Through an ultrasonography, it's the only way to confirm a there is twin pregnancy or not. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel, they haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.